Hello everybody, I'm Dr. Jay Burness, and I'm a microbiologist, a doctor of chiropractic, and an American board certified functional neurologist. I've been in practice in Oakville, Ontario now for over 20 years, and a large part of my practice is the management of patients with headaches, and especially migraine headaches. And the techniques that we use in my practice work very well for the great majority of my patients. As a matter of fact, most of the patients will actually feel their headaches diminishing during the first treatment, and they're almost always surprised when that happens. And I must have been asked 100 times over the years, usually after the first session, how exactly does this work? I mean, how can something so simple have such a dramatic effect so quickly? So, because I've been asked this so many times, I put together this video to try and answer that question for everyone who has asked, and for everyone who will ask the same question in the future. I also hope it helps some of you out there who may be suffering with headaches right now to see that there is a healthier alternative to medications. This simple approach that we use can make a lasting positive change in your quality of life. So, without further ado, here we go. So the first thing we need to understand is that a headache is not a brain ache. Your brain has no sensation. It really can't feel pain. So when we're having a headache, obviously there's pain we're feeling inside our head, so where is it coming from? Well, it's coming from some structures called the meninges and the blood vessels that supply it. The meninges are a series of membranes around the brain inside the skull. They completely encase the brain. They have their own blood supply and they have their own nerve supply. So they are capable of feeling pain. And those nerve fibers travel along the trigeminal nerve into the brain. We'll get into the trigeminal nerve here in a minute. So when a headache begins, first of all, we need to understand that normally your brain is constantly firing. The neurons in the brain are firing back and forth all day long. It's something like 3 billion signals per second are occurring in the brain at any given time. So it's a very high rate of firing. And what science has found now is that when a headache is beginning, that firing rate tends to slow down in the back of the brain here in the occipital lobe most commonly, but it can be in any area, but most commonly the occipital lobe. So we'll see that that area of the brain starts to slow down in terms of its firing. And that slowing down of the firing, that can spread across the entire surface of the brain in a process that's called cortical spreading depression. So when the brain frequency of firing decreases, we get a rapid constriction of the blood vessels that are supplying the brain and the meninges, and that rapid constriction of the blood vessels can generate pain in the meninges and the blood vessels of the meninges. And as I said, those pain-carrying fibers are going to be traveling along the trigeminal nerve into the brain. So the trigeminal nerve is a very large nerve. It innervates the entire face, inside of the mouth, the scalp, the front aspect of the scalp anyway, and it carries a lot of different sensations from the head into the brain, including sensations from the meninges. So when we're looking at a headache, there's a few different players that come into play here. The first one, of course, being the meninges. We just talked about that in the blood vessels. That's our pain generator to begin with. And then there's the area of the brain where that pain signal ultimately has to end up before we're going to become aware of it. It's in the sensory cortex. And then finally, there's the trigeminal nucleus in the brainstem. So when we have a headache, basically we got to start off in the pain generating area, which is the meninges or the blood vessels. We're going to transmit that signal along the trigeminal nerve into the trigeminal nucleus. We're also going to transmit a lot of other things through that trigeminal nerve normally. As I say, it innervates the scalp, ear, face, mouth, and teeth. So there's always all kinds of signals going through that trigeminal nerve into the trigeminal nucleus. And from the trigeminal nucleus, that signal has to be transmitted on to the sensory cortex before we're going to become aware of it. So the trigeminal nucleus has a very, very important job here. It basically processes all the sensations from the head and the face on their way to the brain. And it really acts as a switching station. It kind of decides what we're going to become aware of. It can either amplify the signal coming into it from the face or the head, or it can block that signal so it doesn't get the rest of the way to the cortex where we're going to become aware of it. The thing with the trigeminal nucleus, though, is with a strong enough sensation or repeated sensations of pain, this nucleus can become sensitized. And by sensitized, I mean it begins to preferentially transmit sensations of pain to the brain. And we can see this with repeated headaches. We can see it with a particularly painful injury in the face. It's very common. Dental procedures sometimes, if it's very, very traumatic, you can sensitize this nucleus to the point where now this nucleus is going to transmit pain to the cortex even when there's no more inputting pain signal coming into it. So it becomes basically the source of the pain now, just because those cells have learned to transmit pain preferentially. So the trigeminal nucleus, as I said, is very, very important. When we're trying to deal with headaches, we need to deal with this. This guy's job is naturally to block pain, so we want to get it to do that. So in order to do that, we have to change the trigeminal nucleus, if it's sensitized, so that it learns to block pain signals instead of sending pain signals. And we can do that with functional neurology. We can actually do that through the ear. And the way we do it, it's a fantastic arrangement in terms of the way we're put together. But the trigeminal nucleus is innervated, as I say, from all structures in the head. And the ear in particular, has 4 separate cranial nerves that transmit sensation from it to that trigeminal nucleus. Cranial nerves 5, 7, 9, and 10. And we can use these cranial nerves to drive plasticity for the inhibition of pain in the trigeminal nucleus. Basically what we want to do is, by stimulating the eardrum, the inner canal of the ear, at the appropriate intensity, frequency, and duration, we can bombard that trigeminal nucleus with non-painful stimuli. And these stimulations can be simple as puffs of air. We use mild electrical stimulation as well, nothing that you would feel consciously, or sometimes combination of the two. And basically what we're going to do is we're going to fire that trigeminal nucleus with non-painful stimuli, bombarding it, basically drowning out the painful stimuli in the sensitized nucleus. And by doing that over time, we can build plasticity so that the cells that are firing most of the time in that trigeminal nucleus are the cells that are going to block pain sensations instead of transmit them. So we can desensitize that nucleus. This basically blocks the transmission of pain signals from the trigeminal nucleus to the cortex and eliminates your consciousness, or eliminates the headaches. You don't feel the pain anymore, and again, the nucleus is not firing aberrant anymore. But we also, to complete the picture, we also want to get back to this guy. We want to make sure that we've addressed the cortex as well. In many cases, we have to do that as well. It's one thing to close the gate, but we also want to stop where the pain is coming from. So we may need to drive neuroplastic change there as well, and we can do that again with a similar process and some other brain-based exercises. We also want to address any metabolic weaknesses that might be contributing to that CSD in the first place. So when we deal with headaches, our program for headaches is based on 3 separate entities that we bring together. The first one being an activation technique, and this is what I just described with using the ear. We're basically going to fire the nerve cells of the area of the brain, in this case the trigeminal nucleus, and drive a plastic change in the direction that we want to. We also want to use metabolic support. We need to make sure that the brain, the trigeminal nucleus, has everything it needs to be healthy, namely oxygen and nutrients, so that we can drive that plasticity and get the expected change. And the last thing we want to do is we want to make sure that there isn't anything in terms of a toxin or a trigger or inflammation itself in the nervous system that are contributing to that aberrant neural firing in either the trigeminal nucleus or in that occipital lobe or other area of the brain. So you have to address all 3 of these things together to get the best results. So it is possible to live free of headaches, and this is without the harmful and addictive effects of medications. So I hope this has been informative for you.
So there you have it. So the question was, how does this work? And what you just saw there was the long-winded answer. But the simple answer to the question is that brain function can change in an instant. You just have to know how and where to change it. And that's functional neurology. I'm Dr. Jay Burness.